Hurricane Melissa's devastation has been profound and far-reaching, and communities across Jamaica have endured the loss of lives, livelihoods, and essential services. From the very onset, the United Nations have been working very closely with the national authorities to meet urgent needs.
Melissa brought devastation to a large portion of Jamaica, and because of that, the initial response should be immediate. And our focus was really coordinating the efforts to supply those key important needs for that population in the immediate hours after the hurricane.
From the very onset, the United Nations have been working very closely with the national authorities to meet urgent needs. To date, the United Nations collective efforts have achieved the following. More than 145,000 Jamaicans have received assistance across multiple sectors. Over 45,000 people have benefited from emergency food support. 34,000 residents in Westmorelands, St. Elizabeth and Trelawney received food assistance through collaboration between the Ministry of Labour and Social Security and WFP. More than 14,000 tarpaulins have been distributed by IOM and partners to families whose homes are damaged or destroyed. Water access has improved to 77% functionality, supported by the distribution of over 740,000 litres of safe water led by UNICEF, Water Mission International and the Global Support Development. Today, we mark another important milestone in our collective response, and I'm therefore pleased to confirm the approval of an extra $4 million from the United Nations Central Emergency Response Fund, CERF, to accelerate life-saving humanitarian activities across the hardest hit parishes.
We are here in Westmoreland, taking a look of the water treatment plant that we have thanks to our alliance with Water Mission. We are providing wash to several communities, and as coordinator of the WASH working group, it's really a pleasure to see that working together serve the communities.
The water is very nice, refreshing, socially good, and the system is so good and natural for all Jamaican, all people in the community.
We are here to support the local community, to support local government in ensuring that an essential need of life, which is life-saving water, is provided to the communities that live in this area.
After the impact, one of the biggest challenges we had in terms of getting to communities, or obviously the communities that were marooned, you could not get there by foot, you could not get there by transport, as in bus or cars. So we really had to depend heavily on partners. So IOM has received funding from CERF. Our allocation is $600,000, and this would be used in terms of providing non-food items to affected population and to identify shelters in some of the parishes.
We've already deployed emergency medical teams where they are most urgently needed. We've already started the urgent emergency repairs to the range of primary health care centers and hospitals. In addition, we are already procuring goods to reset up the necessary goods in these primary health care centers so that we have urgent care being able to respond, but primary health care also being able to respond.
So right now, as we are transitioning from in-kind assistance, which is critical during this period where there are no real functioning markets in some of the most affected areas, into cash over the coming weeks, we're also keeping in mind that in the months to come, we need to work on ways to support the recovery effort and transition from the emergency phase into recovery, particularly in those parts of the country that are essential for food production in Jamaica.
And we're totally delighted that this is part of the whole United Nations response plan, working towards getting Jamaica back to where it was. As you know, the devastation that was caused there is unprecedented.
The United Nations remain fully committed. As Jamaica transitions from immediate relief to early recovery, we'll continue to work hand in hand with the government authorities, development partners, and the private sector, civil society, and indeed affected communities. Our shared goal is not only to help Jamaica recover, but to ensure that families, communities, and the nation emerges stronger, safer, and more resilient in its shocks.